How does capsule endoscopy diagnose rectal bleeding causes? Imagine a tiny camera inside a pill that you swallow, traveling naturally through your digestive system. That's what capsule endoscopy is. It's a safe, non-invasive way to look inside parts of your small intestine and lower gastrointestinal tract, including the colon and rectum. When someone has rectal bleeding, doctors often start with tests like colonoscopy or sigmoidoscopy. But sometimes these don't find the source of bleeding, especially if it's coming from deep inside the small intestine. That's where capsule endoscopy really shines. The capsule contains a small camera that takes thousands of pictures as it moves through your digestive system. These images are sent wirelessly to an external recorder, which your doctor reviews carefully. Because the capsule travels on its own, it can reach areas that traditional scopes might miss, especially in the small bowel. This makes it especially helpful when initial tests don't reveal what's causing bleeding. Capsule endoscopy can help identify several causes relevant to colon health and colon cancer. It can detect abnormal blood vessels called angiodysplasia, which can cause bleeding. It can also find signs of inflammation from conditions like Crohn's disease, which affects the digestive tract. The procedure can reveal tumors or polyps that might be early warning signs of cancer, as well as ulcers or erosions in the small bowel that could be bleeding sources. One of the biggest advantages of capsule endoscopy is its ability to find bleeding that is hidden or not obvious. It has a higher chance of detecting obscure gastrointestinal bleeding compared to some other imaging tests. However, it's important to remember that the capsule cannot take tissue samples or perform treatments like stopping bleeding. If the images show suspicious areas, your doctor will likely recommend follow-up procedures such as traditional endoscopy or surgery for confirmation and treatment. Capsule endoscopy isn't suitable for everyone. It's not recommended if you have a suspected bowel blockage or strictures, because the capsule could get stuck. It's also important to note that this test is just one part of a comprehensive evaluation. It provides valuable visual information that can help identify early signs of serious conditions, including those related to colon cancer. Early detection is key to effective management and prevention of disease progression. In summary, capsule endoscopy diagnoses rectal bleeding causes by offering a detailed, non-invasive look inside the small intestine and lower gastrointestinal tract. It helps find bleeding sources that other tests might miss, providing crucial clues about your colon health and potential early signs of cancer. Always consult your healthcare provider to determine the best approach for your specific situation and to interpret the results properly.